So let's talk about normal flora. Okay? The symbiosis that's going on. Living in harmony. Well, not all the time is it harmony, right? Living with your brother or your sister, sometimes it's harmony, sometimes it's not. It's too much harm, right? So it's living together of two dissimilar organisms. Okay? Not brother and sister as a bad example, but a dog and a cat, right? That kind of thing. So we could have these three different types: mutualism, commensalism, or parasitism. The mutualism is that the symbiosis between the two characters, there's a benefit for both. A good example of this is in your large intestines, you are loaded with E. coli. E. coli is a bacteria that is not similar to us, right? But they want to live there, and they can grow over there, and it benefits them. They like all that area right there. They're going to grow. In the meantime, they are going to synthesize vitamin K that we can actually absorb and use for our clotting factors, to make clotting factors 2, 7, 9, and 10 so that we can clot our blood. So here we got mutualism, where they benefit from us, we benefit from them. Okay? Then we also have this commensalism. This is where symbiosis, where one species benefits and the other one is neither helped or harmed. A good example of this, in the vagina, there's candida there, a yeast, fungus. It normally sits there, and it's very low where it's not going to cause any problems, because we have a lot of bacteria, good bacteria, that is keeping that yeast down. But it's still in there. But it's not harming us, it's not helping us. They're growing at a certain rate, not too extravagant, but they are growing there. So this is where that comes in. Okay? Then we have parasitism. This is where the symbiosis, one species benefits and the other one is harmed. All right? And it's just like we said with the plasmodium. That's a good example of malaria, right? That's what's happening with that. We get no benefit out of it. We're harmed from it, in fact. They get all the benefit because they get to live. Okay? Questions of these? Okay. So an opportunistic infection, we talked about this briefly. We'll now get into it. This is where normal flora, it's found in a host, and it doesn't cause any disease, but it has the potential of causing disease. And when you have a good immune system, they're fine. You're keeping that development of that certain bacteria or fungus, whatever, at a low level where it's not going to disturb you. But once your immune system is not doing good, they will party hardy. Okay? And a good example of this is, I'm using the same thing, the candida, the yeast that's in the vagina. If you take too much antibiotics, now keep in mind, there's good bacteria that's in the vagina, and then there's just yeast. If we kill the good bacteria, because the good bacteria is keeping those yeast cells down. So if we kill the good bacteria, then the yeast cells are going to build up. So taking an extra loaded amount of antibiotics is going to kill the good bacteria, and it's going to make the yeast grow. Similarly, douching. Cleaning the vagina with vinegar or these other douche reagents. Doing it often, every day, every week, is not a good thing, because it's going to kill the good bacteria and it's going to make the yeast grow. Same thing if you want to gargle with peroxide to clean all the bacteria that's in your mouth. You want to do that once a month? That's fine. You want to douche once a month? That's fine too. Right after your period? Okay, 12 times a year. But doing it every day or every week, too much. Same thing in your mouth. There's some candida that's in there. You kill off the good bacteria, you will have what we call thrush, which is candida yeast in your mouth. Okay? So that's what happens here. So if we decrease the immune system somehow, then the normal flora will cause these things happening. HIV, right? Aging. You need to know what causes your immune system to go down. Not for this only, but for the rest of your careers. Because you're going to need to know all that. All right? So make sure you know what causes your immune system to go down. Immunocompetent. Are all of you immunocompetent? I hope so. Immunocompetent means that your immune system is working at an optimal level. I didn't say immunocompromised or immunosuppressive. Be careful with the terms. Immunocompromised means that a person has a decreased immunity. And what causes that, and these you should know, there's some other ones too, but these are key ones over here, that if you have a primary immunodeficiency disease, like Virulence disease, the ones that we talked about before, that'll do that. HIV, AIDS, diabetes will decrease your immune system, corticosteroids, prednisone, that kind of stuff. Even when you get older, right? Shingles happens because your immune system goes down, right? Poor adrenal gland function, malnutrition, if you're not eating properly, you're not getting proteins in your body, well, immunoglobulins, antibodies, are made of proteins. So if you don't get proteins in your body, you can't make antibodies, you're going to have infections, right? Many cancers will also cause this. Even stress. You'll see, after 4 weeks of this course, your stress will go up here, and you'll start seeing, I'm getting cold, I'm not feeling well, because your immune system goes down. I was the same way, too, the last 2 years of college, medical school, yeah. I took an extra multivitamin, A through zinc, just to make sure I got that extra boost, because I know my immune system's going down during these hard courses. All right, it kind of makes sense, okay? So you should definitely know these. There's some other ones as we go along, but you should know some of these even from before, okay? Now, septic, aseptic, sterile, asterile. What do all these mean? Do they mean the same thing? What's going on here? Septic means a contamination of any disease-causing microorganism. Person's septic. He's got a disease-causing infection that's in him. Aseptic is free from any disease-causing microorganism. It doesn't mean that they don't have any microorganisms in them. They just don't have any microorganisms that are causing diseases. So you have your normal flora. Okay? Sterile. That means you're free from any microorganisms, whether disease-causing or not. There is no microorganisms in there. And asterile is contamination of any microorganism, whether it's disease-causing or not. So they don't mean the same thing. You got to know these definitions. Will I ask you? Probably not. But you need. It'll be in the questions. A sterile area. You need to know what sterile means, as opposed to septic, right? Or aseptic. You need to know what those terms mean. They don't mean the same thing. Normal flora, okay? Normally, you will have normal flora in these areas here. Skin, vagina, intestines, upper respiratory tract, right above where the trachea is, oral cavity. There is normal flora in there. You can't do anything about it. It's just there. Even in the eyes and in the stomach, you'll have, not a lot, but there'll be some normal flora there too. Okay? Just so you know. These are places where opportunistic infections can occur. These places you better also know too. This is where there should be no bacteria or microorganisms. There should be no normal flora here. In the lower respiratory tract, where your alveoli are, right? In the muscle, blood should be cleared of any kind of bacteria. Your cerebral spinal fluid, peritoneum, pericardium, meninges, urine, most of all your internal organs, they should be clear of all bacteria and microorganisms. If there's some kind of bacteria or virus that goes in there, expect some kind of bad thing going to happen. A ruptured appendix, all that feces and bacteria now goes in a sterile area, which is your peritoneum, you will be septic because it'll go easily into your bloodstream from there. Okay? So, to answer your question, do you need to know about all these different ones here? No. Okay? This is just showing you, like large intestines, you have a brigade of different bacteria over there. When we get into the large intestines and the small intestine, the GI, I'll talk to you, and the book will talk to you about certain ones you need to know. But it will build as you go along with each course. But you should know the places where you should find normal flora, sure. Okay? And these are opportunistic infections. Again, these are not things I want you to know right now. We've mentioned a few things like PCP, TB. We mentioned a few things. When we get into the systems, we will talk more about all those. Okay? And this is just showing you the whole thing about taking antibiotics, and it's going to kill the it's going to kill the good bacteria, allowing the candida to flourish, right? And you get yeast infections in the vagina. And in the mouth too, right? Here's the vagina, this is the outside of the vagina, and there's all this cheesy stuff, right? That's the yeast infection. In the mouth, that's oral thrush. That's candida, that's yeast. In there, and you can see it all in here. Okay? We see it in children, newborns, because their immune system is not up to par yet. Right? Makes sense. Here we also get something called intertrigo candidiasis. Under the breast, it gets heated underneath there. Yeast loves that kind of stuff, loves a lot of heat. So they'll end up growing in areas where there's going to be a lot of heat. Women that don't clean underneath the breast and dry it properly, they will get this rash that usually happens, and it's a yeast infection that's happening there. Okay? Benefits of normal flora? Okay. Nutrient synthesis. Like I mentioned to you before, right? We have E. coli that's sitting in the large intestines. It's going to live there, fine, grow over there. At least we benefit and get vitamin K. Make those clotting factors 2, 7, 9, and 10, right? They can also compete with pathological microbes. As I told you, the good bacteria that's in the vagina is keeping the yeast at a down low. That's what's happening here. Or we could just make sure that we could have practice shooting, target shooting. So we have normal flora there so that our immune system is able to build and see this kind of stuff and is able to build an immune response if it needs to do that. If your body is cleared of any kind of bacteria, how is your immune system going to practice? I would say go into the mud and stuff, get dirty. So you can buy, not so much, I mean, you've got to be careful being taped and stuff, but I'm saying get yourself with, in an area where there's going to be some germs. Get used to it. Your body needs to target practice. So that when it goes to a major kind of infection, it already has an idea of what to do. I'm not saying go and pick something on the floor and eat it. But to a point, yes, get yourself exposed to that. So your immune system gets some practice. Okay? Okay, generalized stages of infection. Okay? So we have different stages. We have this incubation period where the microorganism is there in your body, but you're asymptomatic. Asymptomatic means without symptoms. You have no symptoms, no signs, but it's there in your body. Prodromal is that you get these vague kind of symptoms. I just don't feel like myself today. I don't know, I just feel right? I just feel tired. I don't know, something weird. Vague kind of symptoms. Just tired and lazy, and I don't know, just weak, muscle pain, just vague kind of symptoms. And then you got the acute period where you get whatever infection you have, you get the classic signs. And that's what's happening with that, the typical signs and symptoms of that particular thing. Then you have this convalescence period where the symptoms will either fade away or they'll get worse. Okay? Recovery period, 2 possibilities. It's either you're back to your healthy, normal self, or you're going to have a chronic infection and just be a carrier state, like hepatitis B, right? You got 5 through the whole thing, but you're a carrier now, okay? If there's an overwhelming infection that your body just can't handle, it'll just be called septicemia, right? It goes into your bloodstream. Your body can't handle it. That will just cause death. Okay? So this is a whole picture. It comes from your book. So you have this overwhelming amount of organisms coming into your body, right? Then you've got this incubation period where it's there, but it's not causing any problems. Then you're going to have this prodromal, this vague kind of things, you know, just feel blah today. And then you're going to get the typical, whatever it is, whatever that infection is, the typical signs and symptoms, until your body can fight against it, okay? Convalescence, you can either be a chronic carrier or you're just going to be recovered. But if it's overwhelming, your body can't fight against it, it's just going to go into your bloodstream, overwhelming infection, and cause death. So that's basically how infections happen throughout your whole body. All right? Use the chickenpox that we talked about in the chapter or 2 before as an example and show how this all comes in there. Right? So clinical signs and symptoms, you can have local signs. Inflammation. Rule of thumb is, if you have a purulent exudate, what does purulent mean? What do you see? Pus, yeah. Okay? So if you see pus, good chance it's bacterial origin. Okay? If the liquid that comes out is not pus, but it's more watery, okay, more of a serous exudate, think viral. Is it always like that? Not always, but a rule of thumb. Okay? You could have enlarged lymph nodes, lymphadenopathy, respiratory effects, tissue necrosis. That's all local. Systemic is when you start getting headaches, when you get nausea and vomiting. It's throughout your whole body, right? And my abbreviations you see quite often, HA is headaches, N/V is going to be nausea and vomiting. We use that quite often, okay? Direct versus indirect transmission. Direct transmission is direct from a person to a person. You touch that person, you're going to get a direct transmission. Skin contact, impetigo, very contagious skin infection. You touch that person, you're going to get the same. You're going to get that in impetigo. Sexually transmitted disease is another good example. Sneezing or coughing through air drops, you get it that way. Okay. Horizontal transmission, mother to fetus. We can have a prenatal transmission, which is across the placenta. Or we could have a perinatal transmission, it's through the birth canal. So we could have syphilis. If the mother has syphilis, that bacteria can pass through the placenta and go to the fetus. So we say that's prenatal, because it's before birth. Pre meaning before birth. Perinatal is during birth. So how does that happen? Well, if a mother has herpes, okay, sexual herpes. If the mother has herpes and there's a skin lesion of that in the vagina at the time of delivery, and as the baby comes through there and tears through and breaks that lesion, which is like a little a vesicle filled with water in it, if it comes there and it goes on the face, the baby can get blindness because of that. Okay? So if we know that a woman, a pregnant woman, had herpes before, she's got to be open with us. So we know about this. And if she knows that she's had it, then we need to look in, at the time of delivery, time of labor, we'll put a speculum in, and if we see a herpetic lesion, we don't make her go through, the baby doesn't have a vaginal birth. It's enough to say we have to indicate and do a C-section. Now, it's easier said than done. Let's talk about reality. That's the reason why we're doing a C-section. So dad comes over. We're having a C-section. What's the reason? She has herpes. Herpes? What's going on? That wasn't me. I've seen this as an OBGYN. This is the kind of stories I hear. So that's why we can't say anything, right? The mom has to say to the husband, No, I'm going in for it because I have herpes. Right? But you got to keep in mind, herpes is not something that's viral. It's not something that happened recently. It could, but it could also happen that you've been exposed to it 30 years ago. It's not something that means that got it from him or got it from someplace else, right? Viruses, it's like HIV. You don't know when you got it, right? Not you, but when one person got it. Bacterial's different. If you got syphilis, or you got, well, syphilis is kind of weird because that's different phases. But if you had gonorrhea, chlamydia, you usually get signs and symptoms pretty early from when you got the were infected. That one you could blame on your husband or wife or whatever it was. Okay, because that's something usually within a few weeks that you get these symptoms or something like that. But that's why you got to check here. Okay, that's mom comes in, the grandmother comes in. Why is my daughter getting a C-section? See, you guys are going to be nurses. You're going to see this more than the doctors, right? You're going to have to, talk to your patient and say, what do you want us to say to your family coming in here? Because you need to, because they're going to ask. She's in a C-section. Why? Fetal distress. You want to lie? See, this is where it gets a little bit crazy, right? You guys are going to be nurses, so you need to understand how to deal with this kind of stuff and talk to the patient. How do you want to deal with this? Right? It's more ethical than what you think. Okay? It's not straightforward. Like medicine is a science, which I'm teaching here, but it's also an art. You got to figure out how you want to do this bedside stuff. Okay? So prenatal is before birth. Perinatal is during birth. Postnatal is after birth. Anything that happens afterwards. Okay? Indirect transmission, food and water, fecal material, right? Fomites, we talked about that, passing from one baby to another by toys, right? And animal vectors, all right? And also deep wound trauma. You step on a rusty nail, it goes in much deeper. All right, so let me do virulence factors and toxins. I'm going to talk very fast about this, and then I really want to get into the, introduce you to the pathogens, the bacteria and the fungi, the viruses and whatnot. So let me and virulence factors are basically things that these pathogens keep from your immune system from battling them. So they're kind of like precaution things that they developed. Okay, does that make sense? Whether guns or grenades or whatever, to make sure the immune system doesn't destroy them, because they want to colonize and they want to set up camp and they want to cause disease. So they have developed, through evolution, they have developed ways to combat your immune system so that they can grow and cause disease. And that's what these are. What are these factors or these toxins? Okay, so let's just talk about pathogenicity. Pathogenicity is that ability of a microorganism to cause a disease. That's what we talk about with pathogenicity. So virulence is basically the degree of pathogenicity of the microorganisms. In other words, we could have something that's low virulence versus high virulence. For instance, measles. Measles has a low virulence. When you get it, chances are you're probably just going to get the rash and you don't have to worry about pneumonia or meningitis. It can cause that, but it's unlikely it'll get to that point because your immune system is strong enough to battle it. However, when you have rabies, if you contract that disease, chances are it is going to start affecting your central nervous system. All right? So we say that rabies has a very high virulence because chances are you are going to get the big disease, whereas measles has a low virulence, you're going to get more of the minor kind of thing. Chances. Does that make sense with the two? Okay. And different microorganism species, their diseases can vary. And we say that there's different strains of a certain pathogen. A good example of this is the human papilloma virus, the one that causes cervical cancer in women. Now, there's like 80 different strains of this virus, but only 4 of them actually can cause cancer. The other ones will cause some sort of warts, which isn't going to be debilitating and kill you. Cosmetically, it might be an issue, but it's not going to kill you. So we have a vaccine for HPV that is not going to prevent you from getting all the different strains of HPV. It's just ones that are going to prevent you from getting cancer. Those 4 serotypes or those 4 strains. you will get, not will, but you can still get these strains that cause warts. But if they actually made a vaccine to cover all 80 strands of HPV, well, heck, that'll cost about $5,000 or $6,000 if that. So they only want to deal with, make sure you don't die from this, and the cosmetic stuff kind of live with. We can always burn them off, but you're not going to die from the warts. Does that make sense? So you understand there's different strains, okay? So what is a virulence factor? All right? It's basically factors that's going to, as I mentioned to you, is going to aid that microorganism from not being attacked by your immune system. And it allows them to set up camp and spread throughout your body, whether that organ or even just, like I said, throughout your body. It can be a structure that's found actually right on the microorganism, or it could be something that can be released from that organism. Okay? So things that it can be right attached to them could be like little pili, little suction cups, so to say, that can attach themselves to the urethra so that when you urinate and pee, that it's not going to flush that bacteria off of the wall of your urethra. It's going to stay on there. It'd be like glue. Okay, so that when the urine goes through, it can deal with that big push and then continue what they're doing. Or it could be something that can be released from that organism, the microorganism, and cause problems that way, like throwing a grenade. This isn't causing the problem. The grenade is actually going to cause the problem. Okay? Sometimes referred to them as EXOtoxins or ENDOtoxins. We'll talk about that. So this is just kind of showing you overall a bacteria and all these different things that it can do, which we'll just briefly talk about. Okay? So adhesion factors can be pili, like I said. There's going to be something that's going to attach to something. There could be something called a capsule. A capsule is this glycocalyx substance that's built around the bacteria, and it's difficult then for a macrophage or something of our innate immune system to phagocytize because it's not able to engulf that thing because the capsule is preventing it from doing that. And that's what's happening. Streptococcus pneumoniae can actually have that. Protein A can also cause adhesions. Also protein M, kind of doing the same thing. And there could be also spikes to help help them to mount and adhere to cells or tubular wall. Okay? So these are just adhesion factors and some examples of those. Okay? This is an example of what I said about the capsule. If this is a Streptococcus pneumoniae that's over here, and this is our immune system, this creature here that wants to try to phagocytize this, well, there's a capsule around here. So that's going to make it very difficult for it to engulf that. And here it is, real life, microscope work. We could actually stain the capsules, or the stains actually don't get stained, or the capsule doesn't get stained. And you can see this white glow that's happening all around the bacteria. That's the capsule around there. And this is just some other pictures showing the same kinds of things. Okay? We could also have enzymes that could be, well, not enzymes. There could be something that gets released by these bacteria that can break down some of your tissue. For instance, it could break down your connective tissue, so that if it starts breaking it down, then there's, instead of it being like a, I'm just giving an example, let's say for it to go through ice, it can't go through ice. But if you turn that ice into jello, then the bacteria can get through there. So we have certain enzymes, coagulase, streptokinase, hyaluronidase. Anything that ends with an ACE, by the way, is an enzyme, right? This here, we have hyaluronic acid that's in your connective tissue that kind of holds your connective tissue together. But if you have some enzyme that can actually break down that acid, then that solid area turns into a jello, allowing that bacteria to swim through there no problem. So there might be certain things that get released from the bacteria to help it along so that it can actually go from one place to the other. And many microorganisms have this. Okay? Now, bacteria also have toxins. We have two types of toxins in general, what they can release. One of them is something called an EXOtoxin. An EXOtoxin is secreted by both gram-negative and gram-positive. This is why I asked if everybody took microbiology. It's important to deal with this. Basically, it's all the bacteria. Because bacteria, if you remember, gram-positive and gram-negative, we have all bacteria in the first line of figuring out what this bacteria is that we got to do a gram stain, right? And if it's gram-positive, what color is it? Purple. I saw. Because the next one, gram-negative, is pink, right? So once you figure out that, you just created a 50-50 kind of thing. Hey, I know it's going to be over here. I know it's going to be over here. Okay? But the reason why, it's not so much about the color, because those are the different stains that you got to deal with, but it's more because they stain differently because of the way the structure of the cell wall is. In gram-negative, it's very thin, so because of all the stains you got to give, it'll stain pink. But in gram-positive bacteria, it's pretty thick, and that stains a little bit different. So it's in that way. I'm not going to ask you about those different things in terms of the way the cell wall is. I'm hoping you learn that in in microbiology. But that's where this comes back in, and that's why I'm using gram-negative, gram-positive. We can also classify them if they, I'm sorry, not classify, sorry, let's go back. So exotoxins, they're only secreted by bacteria, gram-negative, gram-positive, which means all of them can release exotoxins. The action of it does not require for the bacteria to be in the host. Now, they had to be in the host at first, release the exotoxin, and then they can die, but the exotoxin is still there. Again, the grenade. I'm the bacteria, I'm throwing a grenade, you could kill me, but the grenade is still going to do its thing, whether I'm there or not. Does that make sense? You see how this goes on? All right? Most are peptides or proteins that are these exotoxins, and most are heat sensitive. In other words, if it gets too hot in there, these will break up. However, there is something called an enterotoxin, and anything that has the prefix entero, think of intestines. Okay? But this one is released by Staph aureus, Staphylococcus aureus, and this one will still survive even in like a fever, right? And these are highly potent things. An endotoxin can only be released by gram-negative bacteria. So think of gram-negative being the endotoxin, right? N. Whereas exotoxins, they can be released by both gram-negative and gram-positive. All are components of the cell wall, and the bacteria has to be there for it to get released. It's a part of the cell wall. So if you destroy if the bacteria gets destroyed, then pieces of the cell wall will go into the bloodstream. So the bacteria has to be there for it to go into the bloodstream. Does that make sense? As opposed to the exotoxin. It's already been released, we can kill the bacteria, but the exotoxin is already out there. So this gets released from the cell wall as the bacteria die and disintegrate. So even though the antibiotics are working, or your immune system is working and killing the bacteria can still cause problems as your immune system is fighting it off. You have to deal with all these endotoxins also. It's made up of a lipopolysaccharide, an LPS layer, okay, which is part of the cell wall. And it can cause fever, inflammation of epithelium, GI, irritation to the GI tract, hemorrhaging, all these different things. So the differences between exotoxin and endotoxins, an exotoxin is where the bacteria is there, the exotoxin gets released. We can kill this, but the exotoxin is what's going to cause the problem. It's already been released. So you don't have to have the bacteria there for this to happen. However, in an endotoxin, the endotoxin is a part of the cell membrane. So if the cell is still there, the bacteria is still there, it can still release the endotoxins. But if we didn't have it there, the endotoxins are not there. Does that make sense? You've got to have it there. All right, so exotoxins, there's 3 different types of exotoxins, very brief about this. They're either going to attack the neurons, so we call them neurotoxins. They can attack the cellular activities, those are cytotoxins, or they can also cause some kind of interference with the GI, and that's where the enterotoxins are coming in. Okay, entero again means intestines, so it could irritate the lining of your GI, nausea and vomiting, that kind of stuff, right? So this is just showing the same thing, but I'm picking a different way of looking at it, and what what bacteria actually causes these particular exotoxins. And this is endotoxins and what they can be released and cause problems, right? This is just, if you do step by step, you can see how endotoxins cause fever, all right?